There's a moment every man dreads. You're sitting in a quiet room, maybe the doctor's office, maybe at home with your family, and someone mentions the word prostate. For many men, especially as we cross the threshold of 60, it's a word that can trigger a rush of emotions, uncertainty, anxiety, even fear. The truth is, our bodies change as we age, and the prostate, a small gland tucked away deep inside, starts to make its presence known in ways we never expected. But here's the real kicker. Sometimes we hear about enlarged prostate, and other times it's prostate cancer. The symptoms can seem similar, the worry can feel the same, but what does it all mean? Today, we're going to cut through the confusion and talk about 5 critical differences between an enlarged prostate and prostate cancer. Because understanding these differences, it can be the key to peace of mind, better health, and maybe even saving your life. Let's start by painting a picture that might feel familiar. Maybe you've noticed it takes a bit longer to pee these days. Maybe you're getting up at night more often, or feeling that sudden urge when you're miles from a bathroom. These symptoms are common, but what do they really mean? Is it just age, or is something more sinister brewing? So let's dive in, heart to heart, man to man, and unravel the mysteries together. First, let's talk about what these terms really mean. The prostate is a walnut-sized gland that sits just below the bladder and surrounds the urethra, the tube that carries urine out of your body. Its main job is to produce the fluid that nourishes and transports sperm. But over time, things change. The most common prostate issue is called benign prostatic hyperplasia, or BPH. That's the medical term for an enlarged prostate. Benign means it's not cancer. The gland simply grows, pressing against the urethra and causing those annoying urinary symptoms. Prostate cancer, on the other hand, is a different beast altogether. It happens when cells in the prostate start to grow uncontrollably, forming tumors that can eventually spread to other parts of the body. While BPH is incredibly common and affects millions of men as they age, prostate cancer is more serious. It's the second most common cancer among men in the United States. And yet, the early signs can look almost identical. That's why it's so important to know the differences. So, what are the 5 critical differences between an enlarged prostate and prostate cancer? Difference number 1, the underlying cause. BPH is a non-cancerous growth. Essentially, your prostate is getting bigger because that's just what it does as you get older. It's not dangerous by itself, but it can cause discomfort and inconvenience. Prostate cancer, though, is caused by genetic mutations in prostate cells. These rogue cells divide uncontrollably, forming tumors that can invade nearby tissues or spread throughout your body. It's not just a matter of age, it's a matter of life and death. Think of it like this. Imagine your prostate as a garden. With BPH, the bushes are getting a bit overgrown, crowding the path and making it harder to walk through. With cancer, though, there's a weed growing in those bushes, one that doesn't belong, one that could take over the whole garden if you don't catch it early. Difference number 2, the symptoms. Here's where things get tricky. Both BPH and prostate cancer can cause urinary symptoms, difficulty starting and stopping urination, a weak stream, frequent urination, and waking up at night to pee. But there are subtle clues that can help you tell them apart. BPH symptoms tend to develop gradually. You might notice them creeping in over months or even years. With prostate cancer, the symptoms can be similar, but there are a few red flags: blood in the urine or semen, pain in the hips, back, or pelvis, unexplained weight loss, and erectile dysfunction. Imagine you're out fishing. With BPH, it's like a slow leak in your boat, annoying but manageable. With prostate cancer, the leak can suddenly get worse, and you might notice other problems cropping up, aches and pains that won't go away, fatigue that doesn't make sense. If you ever notice blood where it shouldn't be, or pain that's getting worse, it's time to see the doctor, don't wait. Difference number 3, the risk factors. BPH is almost a rite of passage for older men. By age 60, about half of us will have some degree of prostate enlargement, and by 80, it's nearly universal. Family history can play a role, but age is the biggest factor. Prostate cancer also becomes more common as we age, but there are other risk factors to consider: genetics, race, lifestyle, and even where you live. African American men are more likely to develop prostate
cancer, and it tends to be more aggressive. If your father or brother had prostate cancer, your risk is higher. Diet, obesity, and exposure to certain chemicals can also play a role. This is where it helps to know your family history and pay attention to your body. If you're over 60, it's worth talking to your doctor about screening, even if you feel fine. Catching cancer early can make all the difference. Difference number 4, the diagnosis. Here's where science steps in. If you're having urinary symptoms, your doctor will likely start with a physical exam and a blood test called PSA, prostate-specific antigen. Both BPH and prostate cancer can raise your PSA levels, but a high PSA doesn't always mean cancer. Sometimes it's just the prostate getting bigger. To tell the difference, doctors may use imaging tests like ultrasound or MRI, or take a biopsy, where a small sample of prostate tissue is examined under a microscope. Let's be honest, none of us likes the idea of a biopsy. But if your doctor recommends one, it's because he's trying to get answers. The truth is, a biopsy is the only way to confirm cancer. If it's just BPH, you'll be relieved to hear it. If it's cancer, you'll know what you're up against, and you can start fighting back. Difference number 5, the treatment. For BPH, the goal is comfort and quality of life. There are medications that can relax the muscles around the prostate or shrink it, making urination easier. In some cases, minor surgery can help remove the excess tissue. Most men with BPH can manage their symptoms and get back to living their lives. Prostate cancer treatment, though, is more aggressive. It depends on how advanced the cancer is. If it's caught early, you might be able to have surgery, radiation therapy, or other treatments to remove or destroy the cancer. If it's more advanced, there are options like hormone therapy, chemotherapy, or newer medicines that target the cancer cells. The bottom line is cancer requires a team effort, a partnership between you, your doctors, and your family. Now, let's take a moment and talk about the emotional side of all this. Facing any prostate issue can be scary. There's the worry about what it means for your health, your relationships, your future. But here's the truth, you're not alone. Millions of men have walked this path before you, and millions more will walk it after. The key is knowledge, knowing what you're dealing with, and knowing that help is available. Think back to the old days, when men didn't talk about these things. Maybe your father or grandfather kept silent, suffering in silence because he was too embarrassed to ask for help. Times have changed. Today, we have better tests, better treatments, and a better understanding of what you're going through. If you're worried about your prostate, don't wait, reach out. Talk to your doctor, talk to your family, talk to other men who've been there. Let's recap the 5 critical differences one more time, so you don't forget. First, the underlying cause, BPH, is a benign, age-related growth, while prostate cancer is a malignant, uncontrolled growth of cells. Second, the symptoms, while both can cause urinary problems, cancer can also cause blood in urine or semen, pain, and weight loss. Third, the risk factors, age is the biggest for both, but cancer is more likely with certain genetics, race, and lifestyle factors. Fourth, the diagnosis, PSA testing, imaging, and biopsy help distinguish between BPH and cancer. Fifth, the treatment, BPH can often be managed with medication or minor surgery, while cancer requires more aggressive intervention. Now, let's talk about what you can do. If you're over 60, or if you have a family history, make prostate health a priority. Schedule regular checkups. Talk to your doctor about PSA. Testing, it's not perfect, but it's a start. If you notice any new symptoms, especially blood in your urine, pain, or unexplained weight loss, take it seriously. But don't let fear take over your life. Most cases of BPH are manageable, and many cases of prostate cancer can be treated successfully if caught early. The key is to stay informed, stay proactive, and refuse to be embarrassed by what's just a part of being a man. I want you to imagine something for a moment. Picture yourself 5 years from now. Maybe you're playing with your grandkids, enjoying a round of golf, or just sitting on the porch watching the sunset. You're healthy, you're active, and you've taken charge of your health. That future is possible, but it starts with knowledge and action today. And if you're struggling right now, if you're worried, or if you've already had a diagnosis, don't give up hope. Medicine has come a long way. There are new treatments, new technologies, and new support groups. Reach out to your family, find a support group, and remember, you're stronger than you think. We've covered a lot today, and I hope you're walking away with answers, not just questions. Prostate health is too important to ignore, and understanding the difference between an enlarged prostate and prostate cancer could save your life, or the life of someone you love. Before we wrap up, here's a message straight from the heart. You have the power to make a difference. Not just for yourself, but for your family, your friends, and every man who's walking this path. Don't let embarrassment or fear hold you back. Stand tall, ask questions, and take control of your health. And now, if this video helped you, don't keep it to yourself. Subscribe now, leave a comment about your experience, and share this with a friend who might need it. Your story could be the one that helps someone else find the courage to seek help. Every man deserves to live his best life, and together, we can make that happen. Thank you for spending time with me today. Take care of yourself, stay strong, and remember, you're not alone. See you soon.